Welcome to the Regulating AI podcast. Join host Sanjay Puri as he explores the dynamic and developing world of artificial intelligence governance. Each episode features deep dives with global leaders at the forefront of regulating AI responsibly, tackling the challenges using AI can bring about head-on and enabling balance without hindering innovation.
Welcome to the Regulating AI podcast. Artificial intelligence, AI, stands at the forefront of technological evolution, with experts predicting that it could add trillions of dollars to our GDP, but it could also negatively impact workforce, national security, and other areas. So how do we regulate it without stifling innovation for AI? Our podcast features insights from various perspectives. We've had industry leaders, government officials, heads of advocacy groups, academics, and together they address pivotal questions that are needed to create practical legislation. I'm very excited to have Professor Effy Vayena with us today. She's the professor of Bioethics at the Swiss Federal Institute of Technology in Zurich, Switzerland. She's also the Associate Vice President for Digital Transformation and Governance at the same institution. I invited her on this show as we want to have many different voices that can create practical legislation. And having the voice of an expert bioethicist is very important. Welcome, Effy. It's an absolute pleasure to have you on the Regulating AI podcast.
Thank you. Thank you for having me.
Effy, can you, for our audience, which is basically, we have members of Congress, their staff, it's a global audience, think tanks, CEOs of companies, AI experts. Can you provide them a brief overview of your work in bioethics and policy? And how does it intersect with emerging technologies like AI?
Sure. So I'm very interested in, and I have been very interested in understanding what are the ethical challenges that are generated when we introduce new technologies in the practice of medicine or in public health. So I've been working on a number of emerging technologies, starting earlier on from reproductive health technologies, from genomics and genomic technologies, and recently, meaning the last 5 to 7 years, I've been thinking a lot about what we do with all the data that we're able to collect and store and analyze. And that led me also to start thinking about artificial intelligence, because of course, the way we use data and analyze them to make algorithms or all kinds of other things that we call AI, have a very important, a significant impact on research, biomedical research. And through that, of course, in applications that we use in medicine, in clinical practice, and even in public health. So what I've been thinking about is not the actual development of technology, that is my colleagues in the various departments of computer science, biomedicine, bioinformatics, and all those other exciting areas of research, but rather, how do we do that? How do we develop this technology and how we use this technology in ways that meet ethical standards? And one particular question that I've been very interested in is, what kind of oversight do we need to have in place when we are enthusiastic about the technology and when we develop it? So we give out, or at the end, we have knowledge and even a product that is actually going to benefit humanity, that's going to fit all of us and our planet in a way that is equitable and fair. And so a lot of my work has been around the kind of overarching theme of oversight, which of course means guidelines, regulation, governance of artificial intelligence and all that it means.
That's very important work, and it's a very broad and very timely what you're doing. How do you see artificial intelligence, AI, influencing the landscape of precision medicine and digital health in the coming years, especially in light of the ethical and policy considerations you talked about?
The thing, of course, is that we are very fascinated by artificial intelligence, right? So we tend to think that we can use it everywhere. And medicine and health and public health are actually a part of this same kind of thinking. So I think it is probably inevitable to see any progress or development of those fields without having AI in it. And what I'm observing, which is not a bad thing, right? It's important that we have those fields of precision medicine, in particular, or digital health, significantly benefiting by the power of artificial intelligence. So what I'm seeing in terms of trends when it comes to the regulatory approaches is like two things. One approach is layering some regulatory requirements on top of existing regulation. Take, for example, medical devices, right? Medical device regulation is well established across many jurisdictions, and it works. Of course, it can always get better and improve, but we're in a position to put on the market safe and effective medical devices. So we have solid regulation here. What we're seeing with artificial intelligence is that there's going to be another layer coming over that. And if you take the European approach, as we see now with the EU AI Act, which is a horizontal type of regulation, right? We have this regulation layering over the medical device regulation. Those who develop it, they have to meet, they have obligations for the existing one on the medical device, and on top of it for the AI Act. So it's going to be a more complex system of requirements and obligations for those who do medical devices, if those devices are enabled or use any form of artificial intelligence. We see in the US a slightly different approach. We don't have so far this horizontal approach to AI regulation, but the FDA has been extremely active of specifying what are the obligations of those who are developing medical devices that are actually using or involve anything around AI. So that's more a sectorial approach that we're seeing in the US. We see the horizontal approach in Europe, but at the end, it's going to be I would call it like a layer of obligations coming on top of other existing regulatory requirements that we have in the space, particularly in digital health through the medical device regulation. But beyond that, as well, if you start seeing obligations about high-risk AI applications, I think we'll see more of those coming into the space of medicine, either through horizontal approaches or through sector-specific.
You covered some very important points in there. The EU AI Act is a horizontal. US is going more industry-specific verticals. Do you think either one is better, or it's maybe combination? What you have any preferences for either what the approaches have been, Effy?
It's a little early to tell, because that's going to be an empirical question at the end. We'll see which one worked out better. And the EU has not yet been enforced, right? You have approved the basic requirement. We will have a couple of years before we see this in action. Of course, companies and everybody else will be preparing in advance of the enforcement. Personally, I tend to be more comfortable with the sectorial approach, in the sense that I think this technology moves so fast that I'm a little concerned about having a sort of blanket approach to a technology that could have extremely different applications in the different sectors. And I would be my own preference, and again, I would like my preference to eventually be informed by the empirical evidence.
Right.
But as a preference, I have a feeling, my feeling is that understanding the sector and regulating around the needs of the particular sector might be more useful and a bit more agile than the big horizontal approach. I understand the rationale of this core technology needing a general attitude towards it, but my impression here in the space of health and medicine is that probably having some basic things that you have to fulfill across the board, but then really paying attention to the needs of the field, of the sector, would probably be more agile and maybe more effective at the end.
Just to follow up, you said obviously, based on empirical evidence, you would prefer more a sectoral approach, because things move very fast, and things are moving so fast right now. Every day your head spins. Large language models, multimodal agents, AGI. Now there is an announcement that OpenAI, your chat box will have memory. The question for policymakers, Effy, is how do they keep pace with this head-spinning changes? And let's say if they do some kind of a legislation, 6 months or 12 months from now, is that going to be effective, whether it's horizontal or vertical? Any thoughts for policymakers?
Absolutely. This is something that my group and I have been actually thinking about quite a bit. And that's where why we've been also thinking a lot and proposing this idea of agile regulation, which means that given the pace of technological development, we need to be able to move fast. If we write a piece of law now that's going to be enforced in 2 years' time, I just don't know where do we begin, right?
Yeah.
Given happening, as you said. The ideas we've been proposing is that for policymakers to be able to keep up with what's happening, first thing they could do, or hopefully they do, is that they do work together with people who develop technology and those who and more stakeholders. So I think it makes perfect sense. If you are a policymaker, you might not necessarily be an expert on the topic you're even regulating, especially if the topic is moving as fast as one does. We need to have a way in which our policymakers and our technology people are communicating and are mutually educating each other what policy is about, what technology is about. So being together, creating these sort of co-producing essentially regulation is what we want. And of course, you could say some people have strong interests, right? Policymakers would have the public's interest in mind. And we know all that from other regulation, not only of technology. So opening up this space of mutual learning, bringing in also civil society, academics, but having this as an ongoing process, I think is really important. It's difficult for anybody to keep up with what's happening. We need to formalize this exchange and to support it so we get a good understanding of where the need is, where the problem is, and how we can protect our citizens, but also make sure that we reap the benefits that we could actually get from this type of innovation. So one thing is co-producing, being in constant exchange. The second, I think, is to attempt regulation is about more than just law, right? We need to develop best practice. Sometimes we need guidelines which are not as strong as law, but they create the culture and attitude around how we do things. And we need to experiment. And so one of the ideas we've been also proposing is to, and others have already spoken about, sandboxes, experimental regulation. So you close a space, you try to experiment with a policy approach, a legal approach. Companies, technologies are playing in that same little sandbox. So we can test whether we should go that way or not. So this, I think, could be, it's not the way we've been doing things, but given our circumstance and the demands of this technology, I think these are a couple of ways we could be thinking about.
Very interesting points, Effy. So one is obviously communicate with wide variety of people, industry, civil society, etc. And then the sandbox. How would the sandbox work? Would it be a real legislative effort, or is it just an attempt, etc.? Because that's a very interesting point for our listeners to know. How would this work?
So we have actually some experience with that. It's not huge experience, but and I think many have been talking about it. So what you do is you make some agreements of that offer people legal certainty, right? Because that's what you want, about how far they could go in using a particular technology, whether it is about how they can access data or how they can work around privacy concerns and data protection, or bias, discrimination, all those kinds of things we were concerned about, or a certain degree of explainability if you're using an algorithm that we may know things about or we may not. create a space, that's the kind of the metaphor of the sandbox where we play in, where those agreements are made, let's say with a community, with a city, with a healthcare system, to try out some of these technologies according to these particular conditions, and then have a way to test and measure what were the risks, how did we mitigate them, what harm came out of this in the protected sort of environment, what benefit came out of this, and whether this type of approach can actually scale. Because that's the big question, right? Sometimes you can do something very safely in a little box, but can it scale? And these are the things you could test in a smaller, protected space where you include the stakeholders' commitment, but also you understand their perspectives while you're experimenting with this piece of law. And I think that could be something, again, not for everything, but for at least some areas and some specific applications also in the space of health and medicine, which is my kind of the area I know better, that could help us identify what kind of legal approaches, what kind of policy, how lenient could we be, or how restrictive we should be, instead of like just theorizing about it, trying it out in a safe space. So that's the idea behind those sandboxes. And we know that there are some promotion of those, but we haven't utilized them to the extent that we should. And hopefully we're going to get more interest in those.
I think it's a great idea. Try it in a small, safe space, and then if it works, then scale it up. I think our listeners, legislators should take that up, and that's why we have these conversations. It's a very innovative idea. Thanks on this, Effy. Effy, how can regulations balance the need for innovation and advancement in AI while we try to protect patient privacy and data security, especially in digital health and precision medicine? Those are some of the challenges that we deal with, especially with AI.
Great question, and a difficult one. So it's but not very new. We have had this issue of how we can benefit patients without stifling not only innovation, but the research and promotion of knowledge for some time. And we had the same question, for example, when we're thinking about research with genomic data, right? There's serious privacy concerns and data protection issues there. But it is important to do that research in order to develop the knowledge we need to offer people and all of us the benefit of better healthcare. So I think I am in the camp that believes that innovation and governance and regulation are not antithetical. They're not at odds. And the reason I believe this is because I want to ask the question of what kind of innovation do we want? We want innovation that benefits people. We do not want innovation that just makes people worse off, or that makes some people really worse off and just a few people better off. And for me, that's like a serious consideration when I think about innovation. So regulation, good regulation, right? And good governance, not any regulation or governance, is the vehicle with which we can make innovation beneficial. We can make innovation that promotes the good of people and our planet. That's how I think about innovation. So I think it is possible to do it. And because I don't think any innovation is innovation we want. We want good innovation that promotes our interests as humans and the interest of us in together with our planet. I think theoretically speaking, at least for me, it's possible. That's my concept of good innovation. The second thing that I believe we have to take into account is regulators can promote innovation, but innovation with keeping those interests in place, the interest in privacy, by doing a number of things. For example, people want and deserve transparency about what's happening with their data. They want fair distribution of benefit. In study after study, when we ask patients anywhere in the world, that's not just Switzerland or US or UK, if they were willing to share their data for the promotion of academic research, knowledge research, they say yes. What they want is to be respected, and what they expect is that the benefit that will come from this knowledge will be fairly distributed. It's not even that it will be distributed to them, to me, that I agreed to the uses of my data. It is that it will be distributed to my community, to people like me, to more people. And so regulators can actually put in place guarantees for those things. So innovation leads to fair distribution of benefit. And in that respect, I think would be more willing as people to take a little bit more risk if we're expecting and if we're guaranteed that the benefit will be shared with all of us. This is where the regulators, I think, have to do a lot of their work.
You made some great points, if I can touch on. So one is your survey studies show that users are open to sharing the data if it benefits the general good, and also if the benefits doesn't have to be cash or money, but some kind of benefits come to that. And what you're saying, that needs to be codified through regulations. If, let's just say, in simplistic terms, if some large language models is scraping patient data and uses it for coming up with some medicine, etc., the benefit of that should also go to these people. I'm trying to simplify it for our audience also. Am I correct in what I've said, Effy, about what you just said?
Exactly. What I'm saying is that people want to see out of that, if somebody uses their data, they want to see that the benefit comes back to them, their communities, and people like them. They also don't want to see that they're harmed, right? If then somebody else uses this data to harm them, what kind of harm? Discriminate them because of something. Nobody wants that. And actually, that's very interesting. Even when you look at cultures that we say they're not very keen on privacy, right? Like we in Europe are more strict about privacy and others are not. Nobody wants to be discriminated. Nobody wants to be harmed because some information which is sensitive about them is misused by somebody. Nobody wants that. What we all want is that is taken care of, so there's no misuse of our data, and that our data are used so we can benefit from those uses. And health is a very sensitive space. We all want a better drug. We all want to be able to relieve our pains. We want to treat our children. This is something we all care immensely about, and we want to share. It's not fair when I can get the drug and you cannot get the drug, right? If it's available out there. So what we want is that if somebody is scraping data with knowledge to people, not scraping it quietly and secretly, but I know about this and I've agreed to this to happen because I know two things. One, I won't be harmed because this is not going to be used against me. And more importantly, I know that out of this, my community, myself perhaps, or people with my disease are going to be benefited.
Yeah, I think those are great points. If we talked about innovation with data security, privacy, if I were to just take it a step further and ask your opinion in terms of health equity and marginalized communities, we have these innovations, the AI, etc. Health equity is a big issue in the US and I'm sure in the rest of the world. How do regulators or how do people, experts like you, make sure that the benefits can go to some of the marginalized communities?
This is a really important issue, and it's a challenging one because we know what's the right thing to do, right? We know that we need to distribute more benefit to the people who need it more and mostly and most. The first challenge we have is a lot of the data that we're using are coming from people who are already more privileged than the people who are less privileged. So we have something that's called health data poverty. So it's a very interesting thing. We're data rich, but we're also poor in terms of having the data from the people we would like to help them most or need most help. The problem we have is this is fed into our AI, into our algorithms. So what our algorithms and AI will spit out is something that does not include those people, right, in the first place. So the first challenge is, how do we go about that? How do we make sure that we actually get to access more data from those communities with the guarantees that we have to have in place? The second thing comes downstream. Let's say we did develop something that works well in one group of people, but because of the lack of data, it doesn't work so well on those communities. We have to be really careful not to use them there. We have to be really careful to test it in these different settings before we put it in use. And so regulators have a way to go about this by putting those different requirements in place and saying that if you develop this algorithm or this product in a predominantly white, very well-off community, you need to make sure that it works. And it could work really well as well in other communities, but it might not. It depends on many factors. So you got to test it with data from them, or you got to test it in that setting, in that clinical setting, before you go out and say, here's my tool or here's my product, and it's good for everybody. And I think this is a way that could help us address the big equity question, an equity challenge rather. Requirements about how these products perform in these different settings. And the second thing we need to figure out is sometimes we may have a really terrific piece of technology that works across the board of people, but it's not well integrated into clinical practice. It's not well integrated into the healthcare system. And it's going to fail because health systems are complex ecosystems, right? It's not just me, the patient, and the technology across from me. It involves so many factors and so many people and institutions. So how do we integrate technology, AI technology, into our healthcare systems? It's going to be the second entry point for more equitable access and more equity, I think, in health.
Basically, two key points you made. One is making sure we get relevant data from these marginalized communities, very important, because it can't just be data from the affluent or those kinds of communities. Second is to making sure these technologies, AI, is integrated into our clinical or health systems is very important to make sure there is health equity, right?
Yes, test them as well. So first is data, second is testing in those communities, and third is integrate the technology into health. You cannot just drop the technology. You got to integrate it. You got to put the right incentives. You got to put the right reimbursement. It's a whole chain reaction you need to keep in mind. And I think if we think about equity from the beginning, from the data point to the end, which is the actual delivery, right, of care, that is in this entire life cycle, I think we have to look at equity at various points, and through that, hopefully we'll get better at it. We have a long way to go.
Yeah, but those are three excellent points for our audience. We've talked a lot about the regulation. Do you worry about over-regulation because it might stifle innovation? As we started the program, I talked about how we want to regulate, but we don't want to stifle innovation. Is that a little bit of your concern, Effy, at all?
It is my concern, and especially sometimes when we get worried and fearful about things, we might start throwing a lot of regulatory obstacles on innovation. So I do worry about this, and this is the reason I mentioned earlier that to get it right, we really need to be in constant dialogue with the people who develop technology, with those who understand how it works. And we should have the honest brokers in there as well. There are clear interests in some people, and they want less regulation or no regulation. But we can't be listening only to them. We got to listen to those who are also for example, academic research, civil society, who can put forward all the different interests, but we also need to understand the technologies we're going to regulate. This is a very fast-pacing field. I think in order not to overregulate, just to do just regulation, right, is this continuous exchange and conversation with those who make technology, those who understand technology, those who are users of technology. Otherwise, we might end up in a scenario where actually instead of regulating the right things, we overregulate some and underregulate elsewhere, which is will be a very unfortunate scenario.
So I'm going to now take the opposite argument of what you said. We don't want to overregulate, and you said it's very important to talk to the industry. There is a growing fear in many cases and through a lot of guests that we have had that you could have 4, 5, 6 companies control this very transformative technology. We've seen this in social media. And because it's when you produce a drug, it takes billions of dollars to do it. When you create large language models because of the GPUs, there's stuff like that, it's very expensive for companies. Any concern towards that, Effy, from your standpoint?
Anytime that any technology is concentrated in just very few hands, I think we should all be concerned about that, because this is powerful technology. And if it's only concentrated in a few, we won't have any saying. So I am concerned about this. And I think there, again, regulators have to be very careful about how concentration of power works. In our democratic societies, we know we should be very careful about those matters. And I think we do have regulatory approaches in place that could help us safeguard that particular issue. What I'm seeing as well, and where we're trying, and perhaps I'll give you an example here, in Switzerland, we're trying also to promote possibilities of developing technology, let's say large language models and other technology, which maybe it's smaller, it's not that size, but it's good technology and gives other stakeholders a right in developing technology. So in Switzerland, we're quite privileged to have actually a significant computing power through our Central Computer Science Center. And one of the projects we're putting in place now is, together with partners from Finland and others in Europe, is to allow or develop a system where this computational power could be accessible to countries or agents who want to develop technology for social good. So the idea here is, if we are as a country privileged in some way of computing power, then we could create an environment which we can give access and opportunity to more than just a few. Now, you could ask me the question, can you guys compete with the big tech? No, and that's not the purpose. But the purpose is to give opportunity and create these coalitions around those who would never have access, but they have great ideas and can possibly, through this kind of access that we create, help solve problems that matter. So there are, I think, around the world initiatives that at least they're not going to go against big tech, because I don't think we're interested in that, but just expand the spectrum of opportunity to others beyond just the few who have the power.
No, that's very interesting, because it's not always the large language models, because now with open source, you have optimized models. They're now actually coming on desktops. They'll be soon on your phones. And innovation can happen anywhere, any place. You'd never heard of OpenAI till maybe a few years ago, and now and the thing I find very interesting is you're not restricting it to Switzerland. You're saying it's a natural resource. It's, if you have a desire, you can do it. So that's fantastic. I think that's a great thing to do, Effy.
And we're trying to think also, again, one thing we should think about very carefully, even if we're regulating in our affluent and wealthy Western countries, we really need to think about the global South altogether, right? We need to think about how can this technology that's just racing ahead, and it's going to benefit us, hopefully, if we also regulate appropriately. But what's happening in that respect to countries that are not so technologically advanced? And there are so many. So how do we regulate is not just about what's happening into our own countries. It's also how do we go about the sharing that power and that benefit with the world. This is, I think, a question that should certainly be on the table.
I think it's a great, because that was going to be my question later on, but you brought it up because large swaths of the population live beyond Western countries, and also they speak different languages. They have large histories where these models are trained on English or some of these Western languages, and we need to engage them. We talk about the digital divide. We don't want an AI divide. So I think it's a great point that you raised, Effy. And we are trying to engage guests over from around the world, especially in this global south, because that's the platform we offer. If you have any suggestions on that, we definitely take that on. Effy, you talked about 3 solutions for dealing with proper access to marginalized, vulnerable communities. Would those solutions also be the same for mitigating biases that might be inherent in AI algorithms for precision medicine or digital health?
Yes, to some extent, yes. I tend to think data are quite crucial in these rates, as if we don't have data from those communities, I think we won't be able to serve them properly. And I think we need to make an effort to generate, to collect, to include, and to be inclusive in that sense. Of course, there are barriers, and that's the difficulty and the challenge. How can we overcome those barriers that do not allow us to have access to these kinds of data? Sometimes simply because these people are so underserved that they're not on our data space. So the first one is that, and I think if we include them, we would have a chance to decrease bias. On the other hand, we know, and this is something I'm saying about AI very frequently, that our world is biased. AI is not just magically producing bias, it's mirroring our structural injustice, our problems, our gender bias, all those things that we know, we've been thinking about for a long time. And so we do have an opportunity, I think, because of the risk of amplification and automation of bias, to step in and say, okay, we're not going to take it. We're going to address the data problem from those communities. But then we need to be very careful downstream again. Even if we have fantastically non-biased, fair algorithm, we may have residual bias in those who deliver care. We may have bias in our systems. We're not AI-based. And so the question of bias is at all those levels, and we need to be extremely mindful of all the points on which that bias can get out and do the harm. Yes to that, getting the right data, testing our products or algorithms or whatever it is that we are producing our knowledge, and making sure it's a good fit for those populations, but also making sure that we measure our outcomes at the end. Because at the end, what we want is that the health outcomes we have are equitable, right? And good for all those communities, not just for some. So I'm advocating for a more holistic way of thinking about bias, not just fix the algorithm, because that will fix the problem. It won't. We need more. And sometimes I even worry that if we just say fix the algorithm, we think the job is done. And we tick the box and we don't worry about the entire system, the healthcare system, for example, the way we treat those communities, the way we serve them. in its entirety because we did our job with fixing one algorithm or a few for that matter. So I advocate for a more holistic take on what it means to advance equitable health.
I think to summarize, you said continue to test, but take a holistic approach, because even the health workers, the caregivers, there could be some challenges even at the point of delivery. So we need a more holistic approach. So those are great points. Effy, do you think that patients and the general public should have a role in how some of these regulations and their perspectives are done, especially relating to AI?
Absolutely. Absolutely. I think they must be involved. We have some experience with involving patients, patient communities, patient organizations into a lot of things, also in genomic medicine and other areas, in drug development, in a market authorization. And it's not a brand new thing. Again, we have some experience. I think we need to involve lay publics, as we call them, in conversations. We need, again, to find fora and establish fora in which we can listen to them and understand also their needs. And by that, I don't mean just study them, do an attitude survey or this kind of stuff. These are very important scientific work, but we need to create opportunities where people are able to raise their voices and their concerns. And I also think we have another responsibility, which is, and by we, policymakers, academics, those of us who have more direct access to technology and to knowledge around it, to inform people, to create opportunities for our publics to know what's happening. And so they can make informed decisions and can also find ways in which they can raise their concerns and their attitudes. So absolutely, really important to make sure that we include people in these conversations.
So include them, educate them, and I think you're saying it's very important. Effy, I could go on for a long time, and we need to have you back here, but you know our audience of, as I said, lawmakers, policymakers, stakeholders. What advice do you have for some of them who are navigating this complex landscape of AI regulation in healthcare for the first time? Because they're not physicians or bioethics experts or healthcare experts. Some final words of thoughts from you to them.
Oh, my message is what I've been saying, I think, throughout this podcast, which is talk to people who understand this technology, listen to different opinions and voices. You will see there's a lot that are very different from one another. And listen to your constituencies as well. Listen to the people. It's not just about educating them. It's also about listening, hearing what they have to say. What are their problems? What are their concerns? Sometimes they may even have ideas about solutions. For me, to our policymakers, and I know their job is not easy in this space, I talk to some frequently, is just make sure that you talk to different kinds of people about this and try to understand as good as possible the space and how it evolves. I think that would be where I have, I guess, my hopes are there in that continuous dialogue and a mutual exchange and learning.
Great points. Talk to many different kinds of people and also listen to your constituents so that they know what is expected of them. So thank you. Sorry, go ahead, Effy.
And maybe one more thing. This is a technology that I don't think it should be, it will know boundaries and borders, at least as far as risks are concerned. And so perhaps the other thing for our policymakers is talk to the policymakers in other countries and in other jurisdictions. Try to see if we can revive multilateralism and go for to some extent, where possible, for more global solutions.
I was going to end on that, but you brought up a very important point, so I'll just maybe take 30 seconds. Do you think international collaboration on something like this is very important?
Yes, I think it's very important. I think it's a must.
Because everybody is doing their own thing, EU, US, China, etc., because it's become more of a nationalism issue, AI nationalism.
Absolutely.
So collaboration, according to you, is very important. Thank you so much, Effy. This has been informative. As I said, we need to have you back because there were so many questions that I had. Our audience really appreciates your insight and input. So thank you so much.
Thank you for having me.
Thank you.
Thanks for tuning in to the Regulating AI Innovate Responsibly podcast. You'll find links in the show notes to any resources mentioned on the show. If you're enjoying our podcast, please subscribe so you'll never miss an episode and leave us a 5-star review.